to speak to you today about neuromas. Neuromas are pinched nerves commonly in the foot. They occur elsewhere in your body, but as a podiatrist, we treat the ones that occur in your foot. The neuroma itself, the most common position is in the third interspace between the third and fourth toes. This is due to a structural abnormality that our body has where the medial and lateral planar nerves separate and then come back together at this point. It makes the nerve slightly larger than would be expected for this region. That starts the problem off. If you have inappropriate shoe gear, an injury that was not treated, if you're squatting or kneeling a lot, that puts tension on this nerve because it starts in the bottom of your foot and runs into the adjacent toes. Because this is most common in the third interspace, it has a name, Morton's neuroma, and this is the most common by far. You can also have them in the fourth interspace, the second interspace, and even the first. And they all have names as well, but this is the most common. Your symptoms are going to start off usually with a numbness or tingling in your toes, sometimes some discomfort in the ball of your foot. Eventually, it'll progress to where it's painful and feels like a cramp. Your toes will feel like they're bending under and tense. When you look at them, they're actually not doing anything. What's happening is the nerve is enlarged and pinched between these two bones. And much like the spring on this model, there's a ligament that attaches all these bones and links them together. So there's only so much space in between here. As this nerve is irritated by the constant trauma of squatting, kneeling, or wearing high-heeled shoes, the nerve swells and enlarges, and that makes less space, so it becomes compressed by the bones. Oftentimes, changing your shoe gear can relieve pressure here. Changing your work activity or ergonomics can relieve the pressure here. Even just something simple as wearing a wider, stiffer soled shoe, like a tennis shoe, can relieve the pain here for quite some time. Now, neuromas are classically defined as a type of tumor, but they will not hurt your health. They do not spread, they do not go to other muscles, tendons, or ligaments, they do not affect the other nerves, but the nerve itself, once the process has started, will continue to get slightly larger. As that develops, your symptoms will get worse. As your symptoms get worse, you will likely want to try the suggestions of wider, stiffer, more supportive shoes, and on the occasion, we have injection therapy that we use a chemical to destroy the nerve. We can also decrease the inflammation in the short term with a steroid injection, and occasionally we will do surgery. But the injection therapy works very well, it's relatively painless, and does not affect your life. There's no stitches, and you can go about your day.